Norovirus. In this video we are going to be explaining to you what norovirus is. A practical guide to understanding how norovirus is transmitted, how it can be managed and steps to reduce transmission, learning outcomes. How to complete in this module you should know what norovirus is and how it is transmitted. Be able to minimise transmission of norovirus. Be able to respond effectively in the event of an outbreak. Know what action to take if you develop symptoms. What is norovirus? Norovirus, which causes diarrhea and vomiting, is one of the most common stomach bugs in the UK. It's also called the winter vomiting bug because it's more common in winter, although you can catch it any time of the year. Norovirus can be very unpleasant, but it usually clears up by itself in a few days. You can normally look after yourself or your child at home. What are the symptoms? The symptoms of norovirus are very distinctive. You're likely to have norovirus if you experience suddenly feeling sick, projectile vomiting, or watery diarrhea. Some people also have a slight fever, headaches, painful stomach cramps, and aching lips. The symptoms appear 1 to 2 days after you become infected and typically last up to 2 or 3 days. What do I do if I have norovirus? If you experience sudden diarrhea and vomiting, the best thing to do is to stay at home until you're feeling better. There's no cure for norovirus, so you have to let it run its course. You don't usually need to get medical advice unless there's a risk of a more serious problem. To help ease your own or your child's symptoms, drink plenty of fluids to avoid dehydration. You need to drink more than usual to replace the fluids lost from vomiting and diarrhea, as well as water. Adults could also try fruit juice and soup. Avoid giving fizzy drinks or fruit juice to children as it can make their diarrhea worse. Babies should continue to feed as usual, either with breast milk or other milk feeds. Take paracetamol for any fever or aches and pains. Get plenty of rest. If you feel like eating, eat plain foods such as soup, rice, pasta and bread. Use special rehydration drinks made from sachets bought from pharmacists. If you have signs of diarrhea such as a dry dehydration such as a dry mouth or dark urine, adults can take anti-diarrhea or anti-vomiting medication. These are not suitable for everyone though, so you should check the medication leaflet or ask your pharmacist or GP for advice before trying them. Get medical advice if your baby or child has passed 6 or more watery stools in the past 24 hours or has vomited 3 times or more in the past 24 hours. Your baby or child is less responsive, feverish or has pale or molted skin, or you or your child has symptoms of severe dehydration such as persistent dizziness, only passing small amounts of urine or no urine at all, or reduced consciousness. Babies and elderly people have a greater risk of becoming dehydrated. You have blooded your symptoms have started to improve after a few days. You or your child have a serious underlying condition such as kidney disease and have diarrhea and vomiting. How is norovirus spread? Norovirus spreads very easily in public places such as hospitals, nursing homes and schools. You can catch it if small particles of vomit or poo from an infected person get into your mouth, such as through close contact with someone with norovirus. They may breathe out small particles containing the virus that you could inhale. eating contaminated food. This can happen if an infected person doesn't wash their hands before handling food. Touching contaminated surfaces or objects. The virus can survive outside the body for several days. Preventing norovirus. It's not always possible to avoid getting norovirus, but following the advice below can help stop the virus spreading. Stay off work or school until at least 48 hours after the symptoms have passed. You should also avoid visiting anyone in hospital during its time. Wash your hands frequently and thoroughly with soap and water, particularly after using the toilet and before preparing food. Don't rely on alcohol hand gels as they do not kill the virus. Disinfect any surfaces or objects that could be contaminated. It's best to use a bleach-based household cleaner. Wash any items of clothing or bedding that could have become contaminated separately on a hot wash to ensure the virus is killed. Don't share towels and flannels. Avoid eating raw, unwashed produce and only eat oysters from a reliable source, as oysters can carry norovirus. Flush away any infected poo or vomit in the toilet and clean the surrounding area. How common is norovirus infection and who gets it? Norovirus is the most common virus causing infection with the gut in adults in the UK. However, norovirus infection can occur in anyone of any age. You can get norovirus infection more than once because your body is not able to maintain immunity to norovirus infection for a long time once you have had it. What is the treatment for norovirus in children? There is no special medication to treat norovirus. The aim is to make sure that your child has plenty of fluids to avoid lack of fluid in the body, dehydration. Until their immune system has the time to clear of infection, children with norovirus can usually be cared for at home. Occasionally, admission to hospital is needed if symptoms are severe or have complications developed. Thank you for watching.